Good day all. This talk will examine the feminist analysis of how health and healthcare work. For feminists, women's health and healthcare must be understood in the context of a patriarchal society. In particular, modern medicine is and always has been male-dominated. Before the mid-20th century, only men were allowed to go to medical school or become doctors. Women were nurses, the obedient servants of male doctors. To this day, over 90% of nurses are women. The number of women doctors began to rise after women gained access to post-secondary education after World War II. However, just as the voice of these women doctors began to be heard, the 80s saw a reorganization of healthcare all across North America, which diminished the authority of all doctors in favor of a new breed of overwhelmingly male hospital administrators and insurance adjusters. As a result, our healthcare system continues to be extremely patriarchal. Medical practitioners claim to be objective and scientific. But when the second wave of the women's movement got going in the 1960s, it quickly showed that the male medical establishment had created a culturally biased and sexist image of women. Medical, research, education, and practice all treated the male body as the normal body and the female body as a deviation from this norm. In medical texts and journals, women were described solely in terms of their reproductive organs and abilities. As far as the medical profession was concerned, women existed solely to reproduce. Doctors went far beyond their medical expertise with claims that all women had an innate need to have children, which they supposedly felt far more intensely than men. Any woman who felt otherwise was labeled as abnormal. A stable marriage with traditional family values and lots of children was presented as every woman's ideal, happy, and healthy life. This view, which supported prevailing gender role stereotypes, was almost universally accepted until feminists challenged it from the 60s on. To this day, studies such as those by Natalie Cho, Deborah Wexler, and others show that when women go to a male doctor with any medical problem which doesn't have to do with reproduction, they are treated in a more cursory and dismissive manner than male patients. Feminists argue that the healthcare system has expanded patriarchy through the medicalization of women's lives. Normal parts of a woman's life, such as pregnancy, childbirth, breastfeeding, menstruation, and menopause, have been redefined as medical problems, which must be overseen and controlled by male health professionals. Medicalization has allowed the healthcare system to be used to exert male social control over women. Male doctors have told women that in order to be healthy, they must conform to prevailing gender roles and gender norms, such as being obedient housewives. More broadly, medicalization has individualized and depoliticized women's problems. In the 60s, the women's movement declared, "The personal is political." This statement was made to fight against the ideology which had been spread by medicalization, stating that if a woman had a problem, it was her individual medical problem to be solved by her doctor, usually with the right drug prescription. The women's movement was only able to take its struggle for women's rights to the political level by demonstrating that supposedly medical and personal problems were actually social and political problems. Now, medicalization does have positive aspects. Most obviously, it makes medical personnel and resources available to women. In more social terms, it can also reduce stigma. Historically, a variety of illnesses have been attributed to an unhealthy or immoral lifestyle, which has led to the stigmatization and social rejection of persons suffering from them. The standard medical model, on the other hand, holds that the patient is not responsible for their own illness. Since women have been stigmatized for their supposed lack of moral character, at least as far back as Eve in the Bible, medicalization of their problems has freed many women from facing social disapproval and ostracism. Also, medicalization has increased the power of doctors over women, but, as the late great Stan Lee said, with great power comes great responsibility. If the problem is caused by the individual's lifestyle, then it's the responsibility of the individual to fix it. But if it's a medical problem, then it is the responsibility of the doctor to fix it. Feminists have pointed to instances of unnecessary medicalization, but there are still many health situations where women welcome the intervention of a doctor. Women do not want demedicalization. They have no desire to abandon the benefits of modern medicine. They just want a greater voice in how they are treated by the medical establishment. But attaining this has required an ongoing struggle against entrenched male authority, a struggle which began in the 19th century and continues to this day. First of all, women's right to control over their own reproduction has been consistently challenged by male authority figures. For most of human history, all over the world, pregnant women were assisted by older women who had themselves gone through pregnancy and so knew what to expect. These women would assist with the childbirth and were commonly called midwives. But in the 19th century, male politicians made midwifery illegal, and women were forced by law to go to male doctors or OBGYNs. These male doctors promptly redefined the experience of childbirth to suit themselves. Women had always given birth in a sitting or crouching position so that gravity could pull the child out. Today, birthing chairs with stirrups are used to gain the same effect. But for centuries, male doctors told birthing women to lie flat on their backs and push. The sole reason for this was to make the procedure easier and more convenient for the doctor, even though it made it more difficult, dangerous, and painful for women. The 20th century also saw a steady increase in the number of C-sections performed, where the birthing process is transformed into a surgical procedure completely under the control of the doctor. In Canada, in 1965, just under 5% of all births were by C-section. But by 2005, over 25% of births were. Even if there is no C-section, the growing tendency is to reduce the mother to the status of a drugged-up observer while the doctor takes charge of the birth. In the late 20th century, midwifery made a comeback, and midwives have fought for the demedicalization of childbirth. Midwives argue that pregnancy and childbirth are not illnesses, but rather natural parts of a woman's life. The mother should be in charge of what happens, with only minimal assistance from anyone else. There should be no drugs, no surgery, no forceps, no male control. This does not mean that midwives reject modern medicine. In the extremely rare event that there is a serious medical problem, the midwife will send the mother to a hospital. Moreover, since midwives spend far more time with their pregnant clients than do male OBGYNs, they normally see any problems well ahead of time. As a result, modern midwives have a health record at least as good as that of OBGYNs, and in some ways better. The struggle over control of women's pregnancy has also become a political hot potato. In the late 19th century, when women were still not allowed to be either doctors or politicians, all male governments across the Western world made all forms of birth control illegal. The women's movement spent the next century fighting to gain women access to contraception and abortion, and with the US Supreme Court's recent repeal of Roe v. Wade, that fight is clearly still far from over. History has already shown us that when abortion is made illegal, it does not disappear. Women just go for illegal or backstreet abortions. These abortions, often performed by persons with inadequate credentials in unsanitary conditions, pose serious health risks for women. Breastfeeding has also become a controversial issue. In the 1960s and 70s, Western corporations began to market infant feeding formula in third world countries. Formula was advertised as being better for babies than breast milk, and using formula became seen as participating in the prosperous West. The attitude was that if Western mothers used it, then it must be good. The problem was that in third world conditions, formula turned out to have many problems. First of all, once the free samples were used up, formula was often either unavailable or unaffordable. Some women who had started to use formula had their breast milk dry up and their babies starved to death. In addition, the powdered formula had to be mixed with water, which was often not clean or sanitary. Bottles and nipples had to be sterilized, which mothers often lacked the resources to do. And the formula often came with either no instructions or instructions in a foreign language, which the mothers could not understand, so they were unable to make the formula properly. As these problems became evident, the late 70s and 80s saw a protest campaign organized against the selling of formula in the third world. Restrictive regulations were introduced, and the World Health Organization declared that breastfeeding was of greater benefit to babies than formula. As a continuation of this, the 80s and 90s saw the rise of a breast is best ideology in the West. As feminists like Courtney Young have documented, since the 80s, women have been subjected to great social pressure to breastfeed their babies rather than feeding them formula. Where women were at first told that formula was better for babies than breast milk, now they were told the opposite. And the same kind of moral pressure was now applied in the opposite direction. Breastfeeding was made into a moral imperative, and women who did not wish to breastfeed were shamed and considered to be bad mothers who are not looking out for the best interests of their babies. However, in practice, none of the social problems which made it difficult to use formula properly in the Third World exist in the West. And 21st century research has shown that most or all of the supposed health benefits of breastfeeding are insignificant or non-existent. Meanwhile, breastfeeding, which must be done every few hours, can make it impossible for women to work or participate in society. Even women who have told their doctors and nurses that breastfeeding is physically painful for them have had their concerns brushed aside in the stampede to embrace the new medical orthodoxy. Male physicians have also claimed that women's physiology makes them susceptible to a variety of mental problems which men do not suffer from, such as hysteria, premenstrual syndrome, postpartum depression, and even postpartum psychosis. Through the 19th century, many women found themselves committed to insane asylums with a diagnosis of hysteria. Today, we recognize that anyone, male or female, can become briefly hysterical, but then they calm down. But in the 19th century, medical professionals claimed that it was a long-term condition which affected only women. In practice, women's so-called hysterical behavior consisted of not obeying their men and trying to stand up for themselves. Feminists argued that the so-called diagnosis of hysteria was just another apparatus of male control over women, aimed particularly at independent-thinking women such as themselves. In the 20th century, the male medical establishment conceded this and removed long-term hysteria from the list of mental illnesses. However, to this day, there are more women than men in the West's mental institutions. The 20th century saw more subtle forms of mental illness attributed to women, PMS and so on. The overall model is that menstruation, pregnancy, and childbirth can drive women temporarily insane. The evidence for this is largely anecdotal and has been challenged by many feminists. Nevertheless, post-pregnancy in particular has been pathologized and is now routinely treated with antidepressants. Feminists Dawn Curry and Valerie Raoul have argued that women have had to go through what they call a struggle for the body. Women have had to fight for control of their own bodies in the face of male cultural expectations, regulations, and even laws which imposed restrictions on what women did with their bodies. The medicalization of women's bodies is one part of this, but it extends to the broader culture and to other social structures. Some feminists have argued that marriage is patriarchal and benefits men at the expense of women, including their health. In the 1970s, Jessie Bernard compiled American national statistics of morbidity and mortality rates for men and women and showed that while getting married improved men's health and life expectancy, it did the opposite for women. Bernard concluded that marriage was bad for women's health. However, since then, times have changed. Men have become more egalitarian and willing to share in domestic responsibilities. Women have entered the workforce and gained financial independence. As a result, statistical studies now show that marriage benefits the health and life expectancy of both men and women. Looking after each other works better than just trying to look after yourself. This is especially true for single women, particularly single mothers, who are one of the poorest segments of Western society, and being poor generally involves having poor health. Being single can also have negative subjective consequences. Loneliness leads to depression, which leads to illness. People need meaningful emotional contact with other people to remain emotionally healthy. Women's work, both at home and in the workplace, can cause health problems. In the home, women often use toxic cleaning substances which can be harmful, suffer burns while doing the cooking, and may be injured with no one to help them if they slip and fall. In addition, social isolation from staying at home can lead to loneliness, depression, anxiety, and other mental health problems. In the workplace, many women perform clerical or secretarial work, which has well-documented health problems. Repetitive strain injuries such as carpal tunnel syndrome, back and neck pain from lengthy sitting, and problems from poor ventilation, poor lighting, and excessive noise. Other common women's occupations include childcare, teaching, especially of young children, and healthcare, especially nursing. All of these have a high risk of exposure to contagious diseases. More broadly, women tend to be concentrated at the low end of each occupation, taking orders from higher-ranked men and doing the tedious, monotonous work. This leads to stress, anxiety, boredom, and a feeling of lacking control over their own lives, all of which can lead to psychological and physical problems. In Canada today, about 2/3 of all professional healthcare providers are women. The largest single healthcare profession, and indeed the largest profession in Canada, is nursing. There are over 300,000 nurses in Canada, and over 90% of them are women. Now, in the 19th and early 20th centuries, women had few options for making a living other than nursing. But those days are long gone. And yet, not only is nursing still an overwhelmingly female occupation, but growing numbers of doctors and other medical professionals are also women. This feminization of healthcare is bringing us full circle to early tribal societies where healthcare was the job of the medicine woman. I would argue that healthcare comes more naturally to women simply because women care about other people more than men do. This has been confirmed by many psychological studies which have found that women consistently score significantly higher than men on scales of compassion and caring. And so, when they're given a free choice, more women than men choose to enter the medical professions where they can care for others. The problem for these women is that they then have to deal with male authority figures. Modern nurses, in particular, have been put into a contradictory position. Their traditional role has been that of the doctor's assistant. The doctor tells the nurse what to do, and the nurse does it. But increasingly, these days, the nurse is an educated professional using sophisticated equipment and making her own decisions. The nurse receives one set of instructions from the hospital administration and another set from the doctor, but must still ultimately make day-to-day decisions herself regarding treatments such as pharmaceutical dosages. She is simultaneously over-supervised and not given enough time to make the decisions she must make herself. This pressure has inevitably led to both growing medical mistakes and growing nurse burnout. The late 20th and early 21st centuries have seen something previously unheard of: growing numbers of nurses leaving the profession because they just can't handle the physical and mental strain. In the broader society, since the sexual revolution of the 60s, Western culture has put increasing pressure on women to change their bodies to be sexier. In other words, to adhere to male standards of physical beauty. Now, this is nothing new. Women have been wearing makeup and attractive clothing to look good for men for thousands of years, and still do. But in the 20th century, the emphasis shifted to altering or perfecting the female body, creating a designer body, at first through diets, then also through plastic surgery. Both of these have led to health problems for women. Dieting has been taken to extremes with the predominance of the cultural norm that thin is in and you can never be too rich or too thin. The constant pressure on women to be thin has led to the rise of eating disorders, which almost exclusively affect women, such as anorexia and bulimia, which can even be fatal. Women are literally dying to be beautiful. The late 20th century saw the rise of a new field of medicine termed anti-aging medicine. This, of course, cannot actually prevent aging, but it can give the appearance of preventing aging. One common anti-aging treatment is where Botox or botulinum toxin is injected into the face to reduce wrinkles, even though it can cause temporary facial paralysis. As a toxin, it is in practice a poison being injected into a healthy body. Women's quest for beauty may also lead to facial surgery, especially rhinoplasty or nose jobs, and liposuction, which consists of suctioning out fat cells in the quest for thinness. But in the US, the most common plastic surgery is, of course, breast augmentation or boob jobs. Every year, over 300,000 American women have this procedure, even though there is absolutely no medical reason for it, and it exposes the woman to a variety of potential health risks, up to and including breast cancer. In short, men have always established cultural norms that women have had to live up to, and they still do. Those norms have changed over time as society has changed, but they've always involved women living up to male norms. Feminists have tried to fight this and have urged women to define themselves instead of accepting male definitions of them. But this is easier said than done in a society in which men hold most of the wealth and power. Throughout its history, the women's movement has consistently fought to improve women's health. Each of the three waves of the movement has pressured for improvements in different aspects of women's health. The first wave fought for women's reproductive rights, which were redefined as part of women's right to control of their own bodies. When male politicians made contraception and abortion illegal in the late 19th century, the women's movement fought to reverse this and had mostly succeeded in the West by the 1920s. The second wave in the 60s and 70s continued the pressure for access to birth control, but also introduced other issues. One of its main accomplishments was to force Western governments to acknowledge the high level of male violence which existed towards women, particularly in the home. Shelters for battered wives were created, and laws against violence and sexual assault towards women were toughened up. Despite this, it is still estimated that between 5 and 10% of women living with a man in the West are subjected to regular violence from their partner. On top of this, there is the possibility of violence or sexual harassment in the workplace and rape by a stranger. Sexual abuse in particular leaves mental scars which generally take much longer to heal than physical injuries. In third world countries, women today are just beginning to take up the struggle that Western women initiated in the 60s. At present, they are far more likely than Western women to be subjected to male violence in a variety of ways. First of all, there is the continuation of old customs, such as female infanticide, female genital mutilation, dowry deaths, honor killings, and sex trafficking. Secondly, in broader terms, there is the continuation of old cultural norms, which state that men are more important than women. Men's needs and wishes are more important than women's. And indeed, women only exist to serve men and provide children. This attitude justifies virtually any act of male violence towards women and is the principal reason that third world countries have much higher rates of femicide, physical abuse of women, and rape than Western countries do. The third wave of the women's movement, beginning in the late 20th century, focused on the intersection of gender with other social factors. Feminists argued that many women faced a double burden as both women and members of a minority. This very much also applies to health. Women generally have poorer health than men, but the women with the poorest health are women of color, in Canada above all Indigenous women, women in poverty, single mothers, and handicapped women. The women's movement has put pressure on the state to provide additional support for such minority groups. In addition, the third wave has embraced self-organization through the internet. With some help from Zoom, women have formed self-help groups that emphasize self-help care. Women are using their experiences of coping with illness to help other women do so. This also boosts the level of information and self-confidence of women, making them less reliant on their doctors. Today, feminists have a love-hate relationship with the medical establishment. While they appreciate the health benefits that modern medicine brings, they do not appreciate the sexist baggage that often accompanies it. Just as women are often treated as second-class citizens in society as a whole, so too are they often treated by the healthcare system. Some of their concerns are ignored, while others are subjected to inordinate male control. Women make up the majority of healthcare workers, but most positions of authority remain filled by men. The feminist struggle for gender equality is very much a part of what is happening in today's healthcare systems worldwide. That concludes what I have to say on the feminist approach to health and healthcare. A transcript of this talk is available if you're interested. Good day, all.